Okay, we're going to walk through a shift assessment for a newborn. Now remember, the shift assessment is different than the initial assessment or the admission assessment of the newborn, in that it is a more focused assessment. We're looking at the general systems of this baby, a kind of a general overview of the things that are important for us to look at each shift. So we are not going to be doing a gestational age assessment and doing a really in-depth assessment of each body system for our shift assessment. Okay, so we're going to start by coming in to the room, and it could be done in mom's room or it could be done in the nursery depending on where the baby is. And your facility protocol is going to determine how frequently you do the shift assessment. Probably the most common would be about every 8 hours, although some hospitals might have you do it every 4. So you need to know your hospital protocol to know how often you're going to do this. If you come in and you find that your newborn is up on mom's chest or mom's holding baby in her arms or in her lap, it's absolutely okay to do your shift assessment while mom's holding the baby or dad's holding the baby. You don't have to have the baby in the bassinet to be able to assess the baby. However, if the baby's already in the bassinet, you can certainly do it there. Now remember, it's also important as you're doing your shift assessment of the baby that you incorporate teaching for the parents and that you let them know the findings that you're noticing as you're doing your shift assessment of their baby. That gives them an opportunity to ask questions and also clarify what they're understanding you to say, and it makes them more comfortable with you and in the care you're giving their baby, but it also makes them more comfortable in the things that they're seeing on their baby. So the first thing that we would want to do, of course, is come in and introduce ourselves and what we're going to do. The next thing that we would do is update the baby's chart. Typically, moms will have a piece of paper at the bedside where they can record diaper changes, feeds, things like that, any kind of spit-ups, episodes, so that they're not writing directly on the baby's chart. So that would be something you would want to update before you start actually doing your assessment, so that you can get kind of that background information and can get some clues about if there is an abnormal feeding pattern, they're having problems feeding, or abnormal stool or void patterns. Okay, of course we're going to do hand hygiene. We're going to wash our hands before we start our assessment. And another important thing is doing stethoscope hygiene. We want to be sure that we clean our stethoscope between our moms and our babies and from patient to patient. A good thing that you can do is before you get started, do your stethoscope hygiene, and then you can just hold it in your hand to warm it while you're doing your vital signs and your kind of initial looking over of the baby, so that it doesn't make the baby cold. Before I start touching the baby, I want to just look at the baby overall, see what the baby's color is. Is this baby pink? And I also want to assess the baby's activity and tone. Is this baby asleep? Is he or she awake and alert, crying, irritable? I want to assess the baby's pain as well. And most hospitals use maybe like a FLAC scale or something like that to assess neonatal pain, and it's in your chart so that you just match the way the baby is behaving, what you're observing in the baby, and the scores that are possible on the FLAC scoring tool. So you would want to do that before you start stimulating the baby, because as soon as you start really touching this baby and wrapping the baby, and certainly palpating the baby, he or she is going to get very upset and start crying. And so you want to do some of those initial assessments before you stimulate the baby. Now we're going to start off by doing vital signs. And remember, there's a very specific order that we want to do these vital signs. We want to start with the respiratory rate, and we're going to count that for a full minute because babies are periodic breathers. Then we're going to do the heart rate, and then we will do the temperature. And that's so that we will hopefully get the most accurate assessment of our baby's vital signs. For a shift assessment, we will not do a blood pressure on the baby. We only do a blood pressure on a baby during that admission assessment, or what sometimes is called an initial assessment of the baby, to get a baseline of that. So I am going to observe the baby's respirations. Now sometimes you might have a baby that's really wrapped tightly and you can't really observe the respirations. So it's okay to really gently unwrap the baby so that you can see respirations. And remember, babies are abdominal breathers as well, so you might notice more abdominally what their respiratory rate is. So I'm going to count for a full minute respiratory rate. Okay, and then I'm going to do heart rate. And remember, we do that with an apical pulse. So I'm going to listen for a full minute. Okay, and then once I'm completed with that, then I will do the temperature. And we do an axillary temperature for our shift assessments. Underneath the arm. And hold that arm firmly flat so that it gets a good reading. Okay. Then we're going to start doing our shift assessment, our overall assessment of this baby. And I'm going to start at the head. And I'm going to look at the overall shape of this baby's head. Is it molded? Is it round? And I'm also going to palpate. So I'm going to palpate the sutures, see if they're overriding. And I'm going to palpate those fontanelles, or the soft spots, and make sure that they are soft and level. And then I'm going to look at the chest, at the respiratory effort. Am I noticing any flaring, which of course would be at the nares? Do I hear any grunting? What is this baby's respiratory effort? And do I see any retractions at the chest? And then I'm going to listen to my breath sounds and my heart sounds for this baby. Okay, and then I'm going to move on down to the abdomen. And what I'm looking for on the abdomen is the shape. I'm going to palpate the well, I'm also going to listen for bowel sounds. Go ahead and do that while I've got the stethoscope on. So I'll listen to bowel sounds as well. Okay, then I'm observing the shape. I'm palpating. The abdomen should be soft. Should not tend to see that the baby is showing signs of pain when I palpate the abdomen. And I'm also going to look at the cord. What does the cord look like? Is it starting to dry up? Is it red around the base of the cord? Is there any discharge? Is there a foul odor? So that's what we're looking at abdomen-wise. And then, of course, I'm going to take off the diaper. Now, notice I don't have gloves on. You don't need gloves on to do your shift assessment of your newborn unless you encounter blood, stool, or urine. So as I take this diaper down, I may discover that I need to put gloves on now. I may not. So I'm going to look and get a good overall view of the skin now to see, now the baby's probably crying. Is the baby still pink when he or she is crying? But also to look, are there any rashes? Are there any lacerations? Anything like that? I'm going to look at the bottom and make sure there are no rashes or lacerations. If this is a baby boy, I'm also going to look, if he had a circumcision, I'm going to assess the circumcision site, make sure that it's healing well, no bleeding, no discharge, anything like that. And I'm also going to look at the skin turgor. And it's important also to turn the baby over and look at the back, because you might have rashes or lacerations on the back. So I'm also looking at the baby's back. Supporting the head, because of course babies don't have good head control. And then of course I would ask mom, do you have any questions about your baby, any problems with feeding, anything like that, so that we could start a conversation if there was anything that the parents were interested in or needed to know.